Welcome to the university, Ariane.
Good morning.
Quite a topical area.
Yes.
Cancer rates, they seem to be higher in some areas of the UK than other areas.
Yes.
Yeah? What are the reasons for that?
Do you mean cancer as in all types of cancer?
Overall.
Overall. So the UK is split into Scotland, England, Wales, and Northern Ireland.
Mm-hmm.
And I guess in Scotland, you have people with fairer skin,
Mm-hmm.
and people with fairer skin are more likely to get melanoma from the lack of melanin in their skin.
Mm-hmm.
And maybe that is because of UV rays and things like that.
Okay.
So maybe it's about geography of whereabouts you live in the UK. I know that down south, it's parts of the year quite sunny, and places like Cornwall, the UV exposure is much higher down south than up north. So maybe different parts of the UK are more likely to get skin cancer.
Right.
There's an overall effect. Maybe it's also because of ethnic groups. So obviously melanin is affected by where you come from ethnically. And so maybe people with more melanin in their skin who live in certain parts of the UK. So I know that in London there's a big South Asian community, and they're less likely to get melanoma and skin cancers. Could it also be a hereditary thing as well? Because cancers come from, they can be like breast cancer and prostate cancer can be inherited from parents.
Okay.
So maybe people who are living in different parts of the UK may have ancestry with people who have cancers.
Understood. Yeah. Carry on.
So what was it? It was... Sorry, can you repeat the question?
Yeah, so the question was, why are cancer rates different in different parts of the country?
Sure. So there may be better healthcare options available in different parts of the country. So there might be better funding in like London, for example, compared to Milton Keynes. There might be better oncologists able to prevent cancer and also treat cancers. Radiology wards, not every hospital has the facilities like the gamma knife and the I guess CT scans and radiography equipment able to scan and look for tumours and things like that.
Right.
Whereas some hospitals may not have those facilities, so those parts of cancer rates are higher. Okay,
well, thank you. We've kind of touched on a few areas, haven't we?
Sure.
I suppose that naturally takes us on to the next step, which is what can we do? So when I say that, I mean we as healthcare professionals, as doctors, what can we do to reduce those gaps in the rates, across the UK? What can we do to even things out?
Okay. So obviously funding is an issue in the NHS, as not everywhere in the UK is equally funded. And it would be better if we managed to get facilities and better research from healthcare professionals. We had better research into ways that we could use less funding but for the same effectiveness of scans and medical imaging.
Got you.
We could reduce the rates of... we could prevent the diseases, as in stop them from proliferating.
Got you.
And spreading the neoplasia.
Right.
If we get to them earlier. So if we manage to develop ways in which scans could be made better as professionals, it would help a lot.
Right. So there's something about funding, there's something about kind of getting there early. Anything else, do you think we can do as doctors to improve things?
I think that working together is a fundamental thing.
All right.
And reporting cases that may be different could help, because medicine is a lifelong learning career pathway, and cancers are always changing. I mean, recently there's the breast cancer drug anastrozole that has just been, I think it's been publicised now, and it's been able to be prescribed by GPs. and that reduces the estrogen rates
Right.
in the blood. And that's because of research and that people have worked together, healthcare professionals, to develop this, and testing has been done. And if this was spread more widely across the UK in areas where breast cancer rates are higher, if there is a correlation, there may be a way that we can actually even this out and maybe even reduce breast cancer all the way down to minimum.
Okay, so we said a few things about what healthcare professionals do. Your council's contacting you, and the voluntary sector as well, locally too, whether you work as a doctor, and they want to help out in trying to improve, cancer rates in your area. What do you think they can do to help?
So the council themselves and the organisations?
Yeah, council and voluntary sector.
So even with limited medical experience, well, I don't know how much medical experience they have or information they know. I think that signs of cancers are a thing that needs to be taken into account.
Yeah.
So making sure that people are aware of what could lead to cancers, like lumps and growths.
Yeah.
Making sure that people know to actually have checkups. So, because people don't really take into account, like if I had a lump on my neck, I wouldn't go straight away to my GP. Sometimes you look online, they say maybe not, maybe it is cancer, maybe it's not. People need to know more publicly that this may be a cancer, and it's better to go to the GP, ask them, and people who are volunteers should be able to spread that word so that this can be prevented, I guess.
Yeah. Okay. Well, thank you very much.
Thank you.
Thank you.